state your name.
Yeah, okay. Hello everyone, my name is Andreas Dreps and I'm working for ICON as the oncology lead in the drug development service department.
Good noon, I think, Andreas, and welcome to our conference.
Thank you.
And this is our first cell and gene conference, sponsored by SAPA-GP. And what's your experience so far?
Oh, it's nice. First of all, I'm very surprised how many attendees you have, and also the speakers. The quality of the presentations is outstanding, and I had the joy to listen this morning to a presentation from the FDA from Dr. Mark, and that was really outstanding. And I think it's a great event, very well organized. Maybe you have to work a little bit on the timing. The speakers will speak within their time slots. No, but it's a great event. A lot of interactive discussions. Yeah.
All right, great. And can you tell us a little bit more about ICON and what you do to help the cell and gene therapy in that field?
Okay, so ICON is a global CRO, and we have now offices in more than 70 countries around the world and close to 40,000 employees. And yeah, in my area of expertise, the oncology development therapeutic area, we are currently running a lot of cell and gene therapy related trials. The main focus, of course, currently is on CAR T cells. But this also includes vaccines, tumor vaccines, and oncolytic viruses. So, and most of the clinical development activities are in the early stage. So that means first in human and dose expansion to evaluate whether these drugs are active in the targeted patient population.
And I think in the oncology field, this is really crowded, right? The small molecules, they're biologics, and the cell and gene therapy is the newcomer.
Yeah, it's clearly the newcomer. And as you just mentioned, we have on the one hand, we have a lot of so-called targeted therapies available. And whether these are antibodies, whether these are small molecules, tyrosine kinase inhibitors as an example. And very recently, over the last 10 years or so, the so-called checkpoint inhibitors, they were really a game changer. But I think the next game changer will come out of the cell and gene therapy, because one of the problems with all the, let me call it, traditional cancer treatments is related to the fact that patients sooner or later will become resistant to the therapies.
Relapse.
And relapse, and unfortunately their tumor grow again. I think the point here is, and that is the hope with cell and gene therapy, is that you have, first of all, a short treatment, a very targeted treatment, with very less side effects, and last but not least with durable responses, and most likely with a chance to cure patients even in the advanced disease setting. That is currently not an option that is available.
Yeah, I agree with you. Cell and gene therapy holds a very great potential here. But do you see any potential hurdles to overcome specific for cell and gene therapy from a clinician's point of view?
From a clinician's point of view, I think one of the hurdles is, and of course it is the manufacturing process.
Okay.
And from a clinician's point of view, what we are currently seeing, this production process is very complex. Yeah. And you might convince the patient to participate in a clinical trial, and then all of a sudden you have to learn that the product is not available because the manufacturing process failed or was delayed. So what do you do with such a patient? What do you do to keep him eligible for the study, although you see the tumor is progressing? And you have to offer some kind of bridging studies, and that could make, at the end of the day, the interpretation of the results very difficult, because when you do a bridging study to keep the tumor under control for a short time window, and then you start with your cell and gene therapy, You might ask the question, what is the contribution of the bridging therapy compared to the...
It's a little bit difficult to differentiate.
I think that is one of the challenges. And another challenge is, from a clinical point of view, I think especially CAR T cells have been very, very successful in hematology diseases. What can we do to transfer the knowledge and the success to the solid tumor area? And there, the challenge is really that it is difficult to identify targets that are exclusively expressed on tumor cells or solid tumor cells. Most of the time you have identified a target and then you realize this target is very high expressed on tumor cells, but also on a lower level on normal cells, and that most likely has the potential of a lot of off-target toxicities when you apply the therapy. And another challenge with solid tumors is the fact that the tumor microenvironment has a lot of mechanism to fight against this new cell and gene therapies. Because they, in this environment, the cancer cells produces growth factors to stimulate the angiogenesis and other factors that at the end of the day help the cancer cells to escape from the cell and gene therapy approach.
Okay, so but despite all these challenges, you still think cell and gene therapy could be the next game changer?
Yeah, I think you have to keep in mind we are at the very beginning of a learning curve, and what we currently see is the amount of knowledge that everything
it's accumulating.
We learn so much more or less every month. So I think we are at the beginning of a learning curve, but that is really the future.
Okay, all right, great. Thank you so much, Dr. Jim, for
You're
stopping
very
by,
welcome.
and enjoy the rest of the conference.
You too.